Hello, my name is Dr. Ginger Manss, and I am the Chief Nursing Officer for Community Medical Centers. I was very excited last year when the American Cancer Society and the National Football League announced that they were going to put some time and energy and resources into screening for lung cancer. You know, you hear so much in this world about breast cancer and about Pap screening, but there's not been a lot of focus on lung cancer. I was excited for two reasons. I've been a lifelong oncology nurse, and this population is very special to me. In addition, I lost my father at the age of 29. My kids were 2 and 4 years old. I still remember the day he was diagnosed. I went to his house and the kids were swimming, and he told me that he had lung cancer. This was in early August. He presented with both liver and bone mets as a stage 4. And 2 months later, on October 10th, he died. My kids really have never gotten to know their grandfather. So as when I came to CMC and the American Cancer Society brought this project to us, the stipulations of this grant were you needed to be a federally qualified health center partnering with a cancer center. CMC serves over 100,000 patients in the San Joaquin, Solano, and Yolo counties in California. We see mostly Medi-Cal and underinsured, and this population really has a need for this type of screening. We were partnering with St. Joseph's Medical Center, and I was the director of the cancer center over there for a number of years, and I knew that they would take really good care of our CMC patients. So last December, I was at the National Lung Cancer Roundtable with the American Cancer Society, and I was thinking a little bit about my dad. You know, there's 500 doctors and researchers and administrators there, all focused on lung cancer screening and lung cancer treatment. And then all of a sudden I thought about my brother. My brother Steve, 67 years old, and started smoking in the Navy. So right then and there I pulled out my phone and I texted him, Steve, call your doctor and ask him to order a low-dose lung CT to screen for lung cancer. Of course, older brother, younger sister, he didn't listen to me. I texted him a few more times, and in February, Steve and his wife called me and they said, well, Ginger, what are we supposed to say to the doctor? You know, we're not medical, we don't know what we're talking about. They live in a little town east of San Diego, and I told them the evidence that since 2011, it has been shown that lung cancer screening in high-risk population absolutely makes a difference in earlier diagnosis and extending life. So he shared that with his doctor, and his doctor did listen to him and ordered the CT. It was ordered for mid-March, and COVID came along and everything was shut down. So Steve didn't get his CT until the end of May, and they did find a 6-centimeter lesion. Steve was freaked out. He did not want to tell his sons. He knew the story of Dad. I said, let's wait, let's get the biopsy and the PET CT. The biopsy did show that it was squamous cell carcinoma, which is the same typology as our dad. The PET CT, however, showed just one positive node, which was really almost the best news we could get. We knew it was going to be a stage 3 because of the size of the lesion, but this is an early stage 3, which has a much higher chance of success with treatment than what our father was diagnosed with a stage 4. So Steve, I'm happy to say, had his surgery 2 weeks ago and is now home doing well. He will need some follow-up chemotherapy because it's an early stage 3, but he has a chance to get to know his grandchildren, which my father did not have a chance. So the program that we've established at CMC is we started with a test of change at one site, getting this information out there. We looked at our data. We have about 5,000 Medicare age patients within our population of 100,000, so it's a chunk. It's a 5%. Of this group, ages 55 to 77, we had about 2,500 smokers. As near as our data could tell, there's about 213 who met that 30-pack year history and were eligible for a CT. And in all of 2019, we only had 2 done, so we knew we had some work to go. This year, we've started that education. We've rolled it out to about 15 of our clinics, 15 of our 23 clinics total. We're beginning this journey, but have had 9 referrals for CTs, with 7 of them done thus far in 2020. So we're excited about the changes that we're making and feel that this will be such a positive thing for our patients. In conclusion, thank you. If you are a doctor, a nurse, an MA, please talk to your patients about their smoking history. If they smoke, give them the resources to quit, and if they meet the eligibility criteria, please order them a low-dose CT. You will save lives and let other people get to know their grandchildren. Thank you.